Hi everyone, we're UrInControl and our venture is about treating stress urinary incontinence or SUI in assigned females at birth, which we will refer to as AFAB. Meet Ria, a 30-year-old woman who has just given birth to a beautiful baby girl. Like any mom, she's struggling to balance demands of her newborn with her daily responsibilities. And on top of all of that, she's experiencing involuntary urination anytime she exerts her body. She's frustrated, but so embarrassed by her condition that it takes her months to consult her primary care physician, who diagnoses her with SUI. So, what is SUI? SUI is involuntary urine leakage due to physical exertion such as laughing, coughing, or even sneezing. On the left, we see that generally, the bladder, neck, and urethra are well supported by the pelvic floor muscles. But on the right, like in Rhea, we see a weakening of pelvic muscles and ligaments that do not sufficiently support the bladder, neck, and urethra. Consequently, during physical exertion, these compromised structures fail to withstand increased abdominal pressure, causing involuntary and unwanted urine leakage. Factors that increase the risk of SUI include pregnancy, high levels of activity, prior pelvic procedures, or pelvic organ prolapse.
Unfortunately, Ria is not alone. 1 in 3 AFABs in the US experience SUI. And of those who have these symptoms, only 45%, less than half, actually seek treatment. So, there are around 30 million adult AFABs in the US suffering from this condition, and 50% of the AFABs who do seek treatment still experience symptoms. What is more shocking is that the total cost of SUI treatment in the US is $12 billion compared to the $8.9 billion for breast cancer treatment. This brings us to our need. AFABs with SUI need an accessible way of supporting the bladder neck during periods of increased abdominal pressure in order to reduce involuntary urine leakage.
Now, back to Ria. She's offered two different paths of treatment, surgical or conservative. First, she considers surgery. However, she immediately rules out surgery because it's invasive and expensive. So she goes down the conservative path. First, she's recommended a pessary, a mechanical device that is inserted into the vagina to support the bladder neck. But the large size and unfamiliar structure frightens her, and she's afraid of how people will view her for using a pessary. She's also offered pelvic therapy, but it requires a huge time commitment she cannot afford with her hectic schedule as a mom. So she tries a disposable, over-the-counter pessary, which behaves similarly to traditional pessaries. But the cost adds up over time, and after all of this, she still suffers from involuntary leakage.
Under the guidance of our amazing mentors, Dr. Mary Austin and Michelle Zwerneman, our team has the technical and clinical expertise to help individuals like Rita. Our project aims to empower women to take ownership of their health. Women's health is a highly neglected field, and women are conditioned to normalize so many things, from intense menstrual pain to involuntary urine leakage. Here, we can create an accessible solution that provides a transformative step towards women making independent decisions about their health and well-being. Thank you.